So this video, I'm going to show you how your COVID-19 vaccine or the Pfizer and BioNTech is prepared before you get the vaccine. What we have here is we administer the Pfizer and BioNTech COVID-19 vaccine. This is allowed for emergency authorization use by the FDA. And this vaccine is an mRNA vaccine type, so it's kind of different from the regular vaccine like the flu shot, the tetanus, and all of that. Currently, this vaccine is indicated for 16 years old and older. But according to the recommendation right now, I think we're vaccinating healthcare workers and 70 years old and older as of right now. So with this vaccine, you need a 2-dose series, first dose, and then you wait 21 days to get your second vaccine. And if a series is started with this vaccine from Pfizer, you are to complete the next series or the second dose with the same vaccine. So this video, I'm going to show you how your COVID-19 vaccine or the Pfizer and BioNTech is prepared before you get the vaccine. The first step is wash your hands for 20 seconds. So you're going to rub all of this. Okay, 20 minutes. Take our vaccine out from a locked refrigerator, and of course these vaccines were already thawed out by pharmacy, and these are my doses for the day. Vaccine has to be room temperature prior to dilution. When vaccine reach room temperature, you're supposed to write the time down. You're also going to need to write the time of dilution. And then in our institution, we're supposed to count how many doses we get in each vial. So once your vaccine reaches room temperature, you have 2 hours to dilute this, and you have 6 hours to administer the vaccine. Now I'm going to show you how we dilute or prepare your shot prior to administration. And I have to check the vaccine to make sure there's no precipitation or any particulate that's floating around. So the vaccine itself is milky white in color. Okay, it's an amorphous solution. So first you're gonna have to tilt this 10 times. 3, 4, 5, 6, 7, 8. So basically no shaking. 10. All right, I'm using a 3cc syringe and needle less than 21 gauge needle to mix your shot. Of course, we use 0.9% sodium chloride USP to mix it with the vaccine. Alright, so we're going to pop the top. This vaccine, according to the manufacturer, has 0.45 mil in here. And then what we're going to do is we're going to add 1.8. So we're going to clean our top. Put air in it. Move this one up. So no air, no bubble, 1.8 mil. Going into the vaccine, which I have already turned 10 times. Going in slowly, and then I'm gonna let the air up a little bit, release the vacuum. Little fluid still there, so I'm gonna push it down, tap, Okay, perfect. And then now I'm gonna have to mix it 10 times. And check the bottle again. Make sure it's no precipitation. Perfect. And now this is ready for drawing. So when the first patient shows up, which is registering right now, I'm gonna go ahead and draw 0.3 ml out of this vial. So again, I'm gonna clean it up. And you cannot pre-fill this syringes, so I usually draw it just before the patient shows up, okay? So I'm gonna pull. Tap the air out. Takes a lot of precision drawing this stuff because you're only giving 0.3. So you want to make sure there's no air bubble and that you do get 0.3 to maximize the efficacy of the vaccine. So this shot now is available for the first patient for today. Of course, when you leave out of the clinic, you're going to have a card just like this. Have your name, your date of birth, and of course what vaccine you receive, and its lot number, care site or the professional that gave you the vaccine, the date that you received it, and of course the back shows you when is your next appointment time. Side effect of COVID-19 vaccine includes usually pain on the injection site, and then so with that you just put cold compresses or ice pack for 48 hours and then heat after that. And then you also will have flu-like symptoms such as fever, chills, body aches, headache for maybe a few days if ever, but most people doesn't report any of that that I have given vaccine to. Of course, the main concern was anaphylaxis because in the study they showed there's a few people that had anaphylaxis reaction. Therefore, you were supposed to wait in the clinic for about 15 minutes, and if you do have history of that, then anaphylaxis due to allergy from medication and stuff, you need to wait about 30 minutes in the clinic before you leave. Of course, you need to call your doctor if any of this side effect worries you, like especially like shortness of breath, pain and swelling to the arm that has not been relieved for a few days, that looking like infected, and of course fast heartbeat, things like that, and you really need to call the doctor right away. Alright, so I hope you guys now know how your vaccine is being prepared before it is being administered to you. Disclaimer, this is not a tutorial or any educational instruction how to dilute or handle this Pfizer and BioNTech COVID-19 vaccine. I will put some links down below from the CDC website as to the proper instruction directly from the manufacturer or from the CDC. That's what you need to follow, and not just look at my video thinking you can do it, okay? This is just for regular patients or regular people that want to know how this vaccine is being mixed. So that's my disclaimer. Anyhow, I hope you guys enjoy this video. Stay safe. Subscribe to East West Picayune. Until then, bye!